Walk into almost any pharmacy today, and the section dedicated to pharmacological intimacy solutions tells a very clear story. The shelves are overwhelmingly packed with pills, supplements, and treatments engineered explicitly for male performance. Women, meanwhile, encounter their own severe physical roadblocks during intimacy. Chronic physical fatigue, stress-induced low mood, and severe physical dryness routinely shut down the body's ability to engage. Yet, if a woman goes looking for an immediate, over-the-counter pharmacological solution to treat those specific physical symptoms, mainstream medicine offers virtually no guidance. The pharmaceutical market operates on a stark gendered double standard, creating a massive vacuum for women who simply need fast, reliable physical relief. But look closely in local Indian pharmacies, and you might find a small pink tablet called Miss Me. At roughly 30 to 40 rupees, it is highly accessible and rapidly gaining attention. The active ingredient inside this pill is 10 milligrams of tadalafil. If that chemical name sounds familiar, it's because tadalafil is globally recognized and heavily marketed exclusively as a men's medication for erectile dysfunction. Prescribing it to women relies on a medical practice called off-label use. Doctors identify exactly how a drug chemically behaves in the body and apply that specific biological mechanism to a demographic entirely different from the original target audience. The pink pill is essentially a hidden medical workaround. It uses an existing, well-understood chemical compound to actively bypass female biological roadblocks. To understand why this works, we have to look closely at human biology. At a microscopic, molecular level, the mechanics of blood flow operate the exact same way regardless of gender. This diagram shows tadalafil operating as a vasodilator. It relaxes blood vessel walls, forcing expansion to accelerate circulation. Pulling back, this chemical surge routes directly to the lower abdomen and pelvic region, dramatically spiking physical sensation. That intense, sudden physical sensation acts as an override switch. It entirely bypasses psychological barriers, like a low mood or deep physical exhaustion, rapidly jump-starting the arousal process from the body up, rather than waiting for the brain to initiate it. Tadalafil cannot artificially generate desire out of thin air. It chemically forces a biological state of physical readiness, leaving the mind compelled to catch up to what the body is already experiencing. That forced physical readiness also solves the secondary biological barrier ruining female intimacy, the acute pain and discomfort caused by natural dryness. Beyond heightening sensation, this sudden increase in blood flow activates the body's glandular system in the pelvic region. As those glands overperform, they produce a highly effective, natural, sticky lubrication. This eliminates the dangerous friction that typically causes pain and disrupts the experience. By removing that friction and maintaining a highly sensitized state, women are able to sustain their performance comfortably and successfully reach climax without physical interruption. The pill chemically engineers the ideal physiological conditions for intimacy, directly replacing a previously painful or exhausting experience with a functional, frictionless physical response. The Miss Me tablet is cheap, sits readily on pharmacy shelves, and is incredibly easy to pick up as an impulse purchase. However, aggressively manipulating the human body's circulatory system carries inherent, immediate dangers. This mapped silhouette of the human body highlights the severe potential side effects of rapid vasodilation. Pushing blood through the body this quickly can trigger intense headaches, severe dizziness, and sudden, visible facial redness. Focusing directly on the cardiovascular system reveals the true danger zone. Women with pre-existing heart conditions or blood pressure irregularities face severe, immediate medical risks if they ingest these vasodilators, as their system can spike into the red. A drug's low price point and over-the-counter availability do not mean its biological impact on the body is mild, or that it is universally safe to consume. Tadalafil presents a sharp duality for women. It serves as a highly effective off-label biohack to cure intimacy fatigue, while simultaneously acting as a highly potent cardiovascular manipulator. Because of this, professional medical consultation is an absolute necessity. A doctor must evaluate your vascular health baseline to ensure your circulatory system can handle the sudden strain before you ever attempt to take the pill. Self-medicating with off-label chemical compounds is a dangerous gamble with your body's most critical systems. The takeaway is strictly clinical. While this off-label workaround can bypass physical roadblocks, It is only safe for those whose cardiovascular health has been cleared by a medical professional.